Thank you for joining us for our next session, the first year thriving after your initial diagnosis. We'd like to thank our sponsor, Merck, for making this session possible. If you're recently been diagnosed with ovarian cancer, it is normal to have a lot of questions about the future. This session will cover the basics on how to navigate your disease as you move from treatment into survivorship. Dr. Emily Coe is our presenter today. Dr. Coe is an associate professor at the University of Pennsylvania Perelman School of Medicine, Department of Obstetrics and Gynecology, Division of Gynecologic Oncology. Thank you for being here, Dr. Coe.
My name is Emily Coe. I'm an associate professor in gynecologic oncology at the University of Pennsylvania. Thank you for the opportunity to speak with you today. I'd like to talk about the first year, thriving after your ovarian cancer diagnosis. A new diagnosis of ovarian cancer brings many things: fear, anger, and frustration, and acceptance and hope. There is no one right or wrong way to cope and thrive with a new diagnosis of ovarian cancer, and it is a journey. It's okay to not be okay. Some days will be better than others, and every individual's journey will be a little bit different. What I like to do is hopefully give you some tips and strategies as you proceed forth with this new journey. A lot of patients have mentioned some of their reactions when they first get a new diagnosis of ovarian cancer. Guilt is one of those and is normal, and so is frustration. One of my recent patients said, "I went to all my checkups. How could this happen?" I think it is really important and very good that patients have attended their usual checkups with their primary care physician or with their gynecologist. Ovarian cancer is difficult to diagnose, and it frequently presents with very vague symptoms. Some patients have bloating, just abdominal discomfort or pressure. Sometimes it's bowel symptoms where their bowel movements become irregular. Sometimes it may be bleeding. It is really difficult to figure out what's going on. And sometimes it takes multiple steps before actually getting to this diagnosis. What we know is that there really are limited screening options for detecting ovarian cancer at an early stage. Currently, there still is no great test that exists for detecting ovarian cancer. There isn't really a blood test nor imaging study that is truly effective. But there are a lot of researchers that are working on this, and I do think that we will find one in the near future. But for now, when we have diagnosed ovarian cancer, we do know how to treat it, and we want to offer strategies for being able to tackle this. Keep in mind that cancer is not your fault. We truly cannot predict who or when ovarian cancer may occur. Though we do know that in certain populations, there may be an underlying increased risk to developing ovarian cancer. For some patients, they do, for example, carry the BRCA or the BRCA gene mutation. And for this subset of population of patients, having the BRCA gene does put them at increased risk for developing ovarian cancer in their lifetime, which could be anywhere from 20 to 40%. That being said, we still cannot predict necessarily who or when this may occur. And for a large majority of patients, they actually don't carry a hereditary genetic condition. It just sort of happened. And this truly is frustrating, but we are learning more every single day. And with that, I think we will have more strategies and more treatments to be able to treat all our patients. Another comment that comes up frequently, and this is again one of my recent patients, when I asked her, you've had a new diagnosis, what were the things that struck you during this first year, first few months even? And she mentioned there's just a lot of fear. There's a lot of fear about the unknowns, fear regarding what the treatments would entail, what the side effects would mean for her, fear about potential loss of being able to do things she previously could do, her usual daily activities that were very important. Fear about losing potentially strength or physical function, and also a lot of fear about emotional coping, even fear about sexual function. All of these are very common and normal reactions that patients have when they get a new diagnosis of ovarian cancer. There's also a lot of concern about, self-worth. How will I be different? Will I be as valuable? How will I be to my family and my community? I think there will be a lot of change, but there are a lot of ways that we can strategize to make the most of it. There's also a lot of fear about longevity and just time. What time will I have? What time will I need? And who knows what that time is? And that is normal. I think there are ways to try to get a better handle on that, even if it's a bit at a time. And there's lastly, a lot of concern about the family. For example, what the family members may be dealing with, stress on their end. Their stress as they are trying to do everything they can to help the patient. Perhaps they're constantly asking, are they doing enough? Or perhaps they have some of their own goals in mind or what they think are important priorities. Sometimes that might even conflict with what the patient feels is the most important priorities to them. And additionally, there may be a lot of concern about responsibility, caretakers. How am I going to get through this and help those that I care for, my children, my relatives, my colleagues? This is all very, very, very real and very common. So hopefully we can talk about a few strategies to manage this. What to expect? With a new diagnosis of ovarian cancer, there is going to be treatment. There's certainly recommendations for treatment. Now, the sequence of treatment may vary, as well as the specific medications used, as well as the type of surgery performed. Suffice it to say, there are many types of ovarian cancer. There are some types that are more commonly found in younger adults or even adolescents, and there are others that are more commonly found in the middle adult age population or older adult age population. By and large, one of the first steps in treatment would be undergoing surgery. That means trying to remove the source of the tumor. Generally refer to that as the ovary, and the fallopian tubes, of course, are related. And additionally, removing any tumor that might be found in the abdominal cavity. As frequently, unfortunately, despite ovarian cancer starting in one place, it can spread to other areas in the abdominal cavity. Now, the main goal of surgery is to clear out as much and generally all the tumor, if possible. That is all the tumor that can be seen and that can be actually cleared out surgically. There are some variations to this. If a patient is particularly young and still trying to consider fertility, there may be some components of fertility sparing surgery that may be able to be performed. And this would be a detailed discussion with the patient and their primary surgical provider or gynecologic oncologist. But the mainstay of treating ovarian cancer usually results in a surgery, including a removal of the uterus, both tubes and ovaries, as well as other areas of potential tumor deposits. And generally, this would be performed by a gynecologic oncologist, though frequently there may be other specialist surgeons involved. Now, surgery is one component of treatment for ovarian cancer, and it is very important to have the full treatment course. That usually also includes some type of chemotherapy or systemic therapy. And by that, we mean receiving some type of medicine through the veins and or some type of medicine by pill, taken by mouth. Now, with the combination treatment of surgery plus chemotherapy, we usually get the best outcomes where we can control the disease most effectively. Now, whether you end up getting surgery first, followed by chemotherapy, or getting chemotherapy first, followed by surgery, and potentially additional chemotherapy to finish, that would be a discussion and a decision made between you and your provider. And there are many factors that go into making that decision, including, the type of potential cancer that is being dealt with, the distribution and degree of the cancer, kind of the baseline medical status of the patient, as well as the preferences that the patient may have for the type of therapy. Together, and this is a joint decision that is made. And suffice it to say, surgery followed by the recovery for surgery could be anywhere for about 4 to 8 weeks. And then chemotherapy could run anywhere from 3 to 6 months thereafter. So the treatment duration is fairly lengthy. And that is something that is to be considered, and we need to have strategies to manage that. In addition to the surgery and chemotherapy aspect, there are other components of care when we deal with ovarian cancer. One of them is genetics. So in general, every new patient diagnosed with ovarian cancer is recommended to consider undergoing genetic testing. And what this refers to is that we now have the ability to test patients, for example, by a small blood sample or a small swab in the cheek, to determine if there may be an underlying hereditary condition that may have put them at risk for developing the ovarian cancer in the first place. And furthermore, this may give us information to help utilize the most effective treatments, particularly chemotherapy or systemic therapy, if a patient has particular genetic conditions. Now we have more targeted therapies available. So by having this information, it not only may help them with their health overall, it may be informative to their family members in their health, but it may also help us target the medications that we can give for treating ovarian cancer. The other component of genetic testing is testing the actual tumor tissue. And the reason for this is now we have the ability to really dive deep into the biology of the tumors. And we realize that not all ovarian cancers are the same biologically. They do vary. They potentially have different genetic signatures or mutations. And as a result, there may be different and more therapeutic options that could be targeted for that patient. So this component of genetic testing can be very helpful. And it can be done at different points in time of the treatment journey. Sometimes it is done relatively early, even before the surgery or quickly thereafter the surgery or during chemotherapy. Sometimes it might be done a little bit later, but frequently, generally during the first year's time frame is a good time to do it. Now, after you've completed your treatment with surgery and chemotherapy, you would go into what we call surveillance. And this is where you would be followed very closely by your care team to monitor for any side effects and manage those. Also to monitor for any possibility of the cancer coming back. And we do this through a combination of physical exams in the office, as well as using imaging studies such as CT scans or CAT scans, as well as doing particular blood tests, including tumor markers, for example, most commonly CA-125. And you would have a schedule and you'd have instructions from your physician and care team about the frequency of these visits and testing. Typically, most patients are certainly monitored closely for the first 3 years and generally even up to 5 years, sometimes even longer depending on their specific situation and diagnosis. And further, I'd like to mention clinical trials. This does come up. What is a clinical trial? Where does it fit in? So a clinical trial is an opportunity to have access really to a newer treatment or newer drug. Generally speaking, clinical trials would certainly give you the opportunity to have as good as all the standardly available therapy. but frequently they're introducing another potentially newer therapy that may have even greater benefit. Because it is a newer therapy, it is being studied, and of course, patients would be monitored very closely for side effects and tolerance of these newer agents. And it truly, I think, provides a additional opportunity for therapy. So clinical trials could come into play at different points in the cancer journey, even as upfront, before surgery. It could be with receipt of chemotherapy, or it could be following surgery or afterwards. There are many different types of clinical trials that are available, and your care team would be able to give you more information about them. One good reference that's listed here is www.clinicaltrials.gov. It essentially lists virtually all the clinical trials that are running in the country, and actually many that are running internationally for ovarian cancer, as well as many other conditions of the body. And this is a very searchable website. The information is quite detailed though. So, I do recommend that you, have questions and work with your care team to see if there are clinical trials that would be suitable for you. Now, as we think about this journey, I think it's very important to think about what are our self-care strategies for, you yourself as a patient, as well as for your family, work environment. And how do we do this? I think it is important to really think about yourself, to some extent be selfish, and set small goals. And some of these goals may be involving time and food, activity, support. Sometimes these things seem to be very simple items, but they are truly, really important. And how do we do this? Well, I do think this is a learning process. And as one of my patients recently mentioned, it was just a whirlwind of learning. How do we learn? Well, here are a few tips. One, you're not doing this alone, and do not try to figure this all out by yourself. As my patient said, at first, her first instinct was to jump on the internet and try to start reading and searching. And then she realized, nope. Don't want to just go crazy reading anything out there. There is so much information out there. A lot of it is just not relevant. A lot of it may be one extreme or another. And probably best just to try to stay focused, write down the questions, and then actually ask your care provider. That's probably the best start. Now, there are, of course, immediate resources, and then there are more external resources, and we'll talk about that. And certainly there are available, social resources out there. There are support groups out there. Some are group forums, some are one-on-one, and those can be very helpful as well. When we think about resources for information, I kind of think about it as internal as well as external. In terms of internal, I think about the medical treatment team first. They're your direct providers. They're going to be your most direct source of information. And hopefully we would expect that be information that is most unique and most applicable to your situation. Of course, friends and family, there are going to be many other folks who are going to seek information, talk to others, be feeding you information. And I think it's important to, it is important to take that in, but to then hone it down and bring it back to your medical treatment team to see what really is relevant to you. With external resources, there are many. There are social networks, there are online resources, internet resources. There are many local, regional, and national groups out there, which I will mention in the next couple slides. And furthermore, there are even, resources for different populations. There is a difference, I think, between, say, adolescent and young adults versus those in more mid-adulthood versus those in much older populations with just priorities, needs, and coping skills and strategies. I recently had a younger patient, really an adolescent young adult patient who, was looking for resources and said, well, it just seems like most of them are really meant for older adults. What is there out there for us? And sometimes you might have to think even more creatively and think about who are our pediatric colleagues, maybe in surgical medical oncology. But for example, here's one resource that's available online from ASCO, the American Society of Clinical Oncology, where there are resources for young adults with cancer. I just like to highlight that to say there are available resources out there. Now, learning from your medical treatment team, who is on your team? This could vary, from location to location, but overall, there are probably multiple members on your treatment team. One, there's going to be physician or physicians. Generally speaking, there will be a surgeon, and probably most commonly, it would be a gynecologic oncologist who would be performing your surgery, either with your diagnosis of ovarian cancer or maybe helping thereafter. Now, the gynecologic oncologist may frequently collaborate with other surgical specialists, including surgical oncologists, sometimes to manage other areas of the abdominal cavity, particularly in the upper abdomen. Sometimes there may be a colorectal surgeon that's also involved. Sometimes there may be a urologic surgeon who's a specialist in the bladder and kidney systems that may be involved. And the reason is because ovarian cancer, as we talked about, can be distributed throughout the belly cavity. And that actually is the most common scenario that patients present with, is this situation of disseminated disease, or what we call, advanced stage ovarian cancer. The good news is there are folks that can help manage this surgically. Now, other physicians on your team would be those that manage the chemotherapy. And this may be your gynecologic oncologist as well. So it could be the same person. Or in different systems, it could be a medical oncologist. So basically an internal medicine physician trained provider who then has a deep training in chemotherapeutics. And together they would partner with your surgical team to provide the chemotherapy. Now, on top of that, frequently there are nurse practitioners and physician assistants that are really core members of your care team that work alongside your physician. They're extremely good resources and sometimes even more accessible than the physician themselves. There may also be a nurse navigator or oncology nurse that, again, is part of your team and will be answering a lot of questions and giving a lot of support and care. There may be a palliative care provider. And these folks are physicians and also advanced practice providers specifically trained to manage the many symptoms that treatment for ovarian cancer may face. Additionally, the genetic counselor, geneticist, as we talked about. And additionally, for example, a dietitian or nutritionist could be part of your team and very helpful, as well as a physical therapist or even lymphedema specialist. As you're going through these treatments, including surgery as well as chemotherapy, sometimes there could be discomfort, especially in the abdominal pelvic area. And these folks can really help you maintain that function and manage some of those side effects. And furthermore, counselors, psychologists, psychiatrists, many folks find that these folks are also very helpful, especially getting through the first few months of treatment or even after. There's just a lot of ups and downs and a lot of things to deal with. And lastly, social worker, financial counselors can be, again, very, very helpful just to help you navigate your daily needs, to find that strategy to manage the finances, your work, etc. So as I mentioned, there are community resources out there, and these are listed here, just a few of them. For example, the Ovarian Cancer Research Alliance, the National Ovarian Cancer Coalition, the Foundation for Women's Cancer, Sandy Roman Ovarian Cancer Foundation, and additional really hopeful resources, American Cancer Society, American Society of Clinical Oncologists, the Society of Gynecologic Oncologists. Those are just a small handful of the many, many useful resources that are available out there. And so feel free to browse those websites listed. Now, regarding time, like we talked about, I think it is important to think about yourself And there needs to be time to adjust to the expectations and the new expectations for yourself, for your work, your home, family, and friends. You have to give yourself a little bit of slack. You know, I think treatment just takes time. It takes energy. And I think through it all, it is important to find a little bit of gratitude. There will be a lot of down days, but then there are going to be, days that are better. And I think finding a little gratitude does help everyone kind of get through the hardest times. Additionally, a lot of folks around you may be afraid to ask how you're doing or want to help, but don't really know how. And sometimes maybe we just thank them for that and thank them for wanting to help. Maybe it isn't a great time right now, but potentially, in the future, there will be a better time. It's always good to have a few extra helping hands on your side. Regarding financial and social aspects, where can we look to? Are there resources? What we do know is that well over probably half of patients dealing with ovarian cancer do have concerns regarding work, regarding finances, regarding insurance. And there are resources to help on this front. It may be best to start with your cancer care team and the social worker there if that is available. But if that isn't, and you're looking for other information, for example, regarding food resources or transportation, childcare, even family, housing or medication, I'm going to share a few resources here for you. So here listed through, again, the American Society of Clinical Oncology are some resources that are just publicly available for anyone to reference. And within that website, they do link to many other organizations and resources that are available. And I've just listed some of them here. The webpage is quite comprehensive. And for example, we have the Cancer Financial Assistance Coalition, or Cancer Care, Family Reach, the SAM Fund, etc. And additionally, another resource would be the American Cancer Society. And they also have some information regarding good places to go in terms of looking for assistance for whether it's your treatment, whether it's just your daily care and activities or your family. And it is part of the treatment journey. A lot of patients are facing these challenges. So I think it is important to keep in mind, as we've been talking, reset the expectations. Some days will be better, some days worse. Some days you'll be more active, some days less. But there will be ups and downs. And when there's a down day, there will be a better up day to come. Now, how do we try to look for those opportunities, to try to help ourselves kind of manage the treatment as best as possible? One aspect may be nutrition. What we know as patients go through chemotherapy is that taste changes. Now think of this as an opportunity. Maybe it's an opportunity to try new foods. What you thought of not being tasty previously may now be tasty. And what you used to like, you may not like as much. And that's okay. Being flexible may really open some doors here. Taking in smaller meals at a time may really make it easier to digest, especially if you're already feeling a bit bloated or feeling a lot of abdominal pressure. Be flexible with the meal times. We don't have to stick with a strict schedule. As long as we spread them out through the day, it's going to be much easier to tolerate. And when we take the food in, think about what we can do to get the most nutrition possible. Foods that are higher in protein, such as eggs, maybe hard-boiled, relatively bland, so hopefully easy to tolerate, but very nutritious. Things like peanut butter, almond butter are also great sources of protein. Smoothies, for example, that you either buy or make yourself, can be taken, especially even between meals, as a supplement, and that can give you a little bit of hydration and fluids as well as nutrition. And then other items such as yogurt and cottage cheese really are very nutritious and can be good supplements or even be the main part of a meal. Thinking about how to get in some healthy oils like olive oil, avocado, nut butter is also great. Trying to reduce things such as heavy fried foods and spicy foods would be better and easier to tolerate, especially when you're going through treatment. And with taking in, nutrition in small bites, I think it does help you get more energized and give you the nutrients you need to be able to manage the stress of treatment. Now, to reduce bloating, what you could do is avoid carbonated drinks and limit caffeinated drinks such as coffee, tea, and sodas because they will just really dehydrate you more. Avoid straws because that could cause you to just swallow a lot more air. And then some vegetables could cause a little more bloating, such as broccoli, cabbage, cauliflower, bok choy. It doesn't mean you can't have any of these, but maybe just perhaps be selective about when you eat them. Additionally, try to stay hydrated. Frequently patients just don't feel as well, don't feel like taking in as much per se, and occasionally a little bit nauseated with the chemo, though we have really great medications to abate the nausea issue. So I'd say these days, most of my patients actually say they feel quite fine, even are able to work potentially during their chemotherapy. But to stay hydrated, it's important to think of not just the day of your treatment, but even the day before. If you start, trying to just encourage and increase fluid intake, I think that will help. Again, avoid caffeinated beverages, stick with more decaffeinated teas or coffees. Water with fruit in it often gives a nice refreshing, a different flavor that's palatable. Even warm water with honey is a good way to get a little bit of hydration. And additionally, a lot of times patients may face constipation. This is not uncommon, especially going through chemotherapy. Some of the nausea medications that work very well during chemotherapy can cause a little bit of constipation. So keeping on a schedule with regular stool softeners, a gentle laxative, over-the-counter products are usually all you need. But even thinking ahead, even taking that the day before your chemo or the first couple of days after can really help you balance some of those up and downs. Again, diet and changing it according to your treatment schedule could be helpful as well. If, some types of vegetables or prunes help you, then maybe taking that on certain days around your treatment schedule would be beneficial. Remember to hydrate, and even trying to stay active with a little bit of activity and exercise can relieve the constipation if you're walking, for example. Diarrhea, sort of the opposite here, can also happen. And again, it's really important to hydrate, avoid those caffeinated drinks, because that will only make you more dehydrated. Drink after each bowel movement, and perhaps stick with a more blander diet for those times, such as a rice, banana, oatmeal, potatoes without the skin. Something called like a brat diet could be helpful. Avoid fatty foods because sometimes that can just exacerbate the diarrhea as well. And what about activity? I think in general, it's important to stay active for multiple reasons. It improves and maintains strength. And having that bit of strength helps in many, many ways. It can help with the aches and pains. It can help just being mobile and accomplish daily activities. It also can help with mood. There's been a lot of studies where even just 5 or 10 minutes of a small activity every day, whether it be walking or even bicycling in a stationary setting, or even arm exercises, for example, can help improve mood. Because we know that with exercise, the body does release some of those good hormones, the endorphins, and that then kind of improves the mood and makes you feel a little better and improves energy and outlook. It's also a good way to channel stress for some people. Just working it out, if you will, is a great way to get rid of stress and frustration. And so for that reason, exercise can be very helpful. And it's important to be flexible with your goals. We don't need to set lofty goals. It could be as simple as we're going to walk outside once or twice a day. We're going to go check the mail from the mailbox today. Or we're going to do something that is a small but meaningful activity, something that you might enjoy. I think just setting a goal a day, one activity a day, is a really good place to be. And if that becomes too easy, then you can up it and do a little bit more. And again, like we've talked about, there are going to be some days that are better than others. And with chemotherapy, for example, most patients say, oh, the first day or two, maybe I don't notice too much, but then it hits. The next 3 to 7 days can be a bit tough, really tiring. And then it gets better after that. So some days you would do a little more, some days you do a little less. Now with fatigue, this is a very, very common complaint of patients. I'd say probably 3/4 of all patients, probably all patients complain of fatigue, and that is one of the biggest issues. How do we manage that? I think it's important to be flexible with our daily activities and schedule. Take brief naps. Maybe you didn't before, but this time it is okay to do so. And a brief nap, 20, 30 minutes, can be really helpful. If you sleep much, much longer, 2-3 hours during the day, it could throw off your sleep cycle at night. So generally we recommend try to do brief naps rather than prolonged naps during the day. Try to prioritize sleep hygiene, meaning, try to have a regular bedtime, try to have calming activities before you go to sleep at night. Generally avoid anything too strenuous or too hyper late at night, because then that kind of does rev up the body. And it's harder to get calm and get to a sleep state. Also, optimize diet and exercise. If you do some activity regularly in the daytime, it usually does help your sleep at night. Other things may be like managing anemia, and this you would do with your physician or care providers. Sometimes they can help you with either medications or nutrition to improve anemia, if that is a component of the fatigue. You can also even review with your provider. Maybe there are some medications that could be modified. Some medications can be more fatiguing, if you will, and maybe there's an opportunity to change those as well. And then one aspect is just mood. Sometimes there's a very close relationship between mood, depression, anxiety, and fatigue. And here, working with a counselor, working with your providers, your family, you may be able to improve your mood and then overall just improve fatigue as well. Another aspect that patients may have to face, a lot of my patients have faced this, something they call brain fog. They feel like when they're in the treatment, sometimes it's just harder to remember all the things that they used to easily remember or to keep track of or stay organized with. I think it's important to write down questions, write down lists. If not on a piece of paper, then on your phone or whatever media you prefer that's easy to do. Sometimes it's hard to write. There might be a bit of neuropathy and it's harder to type or use a pen. Maybe even doing some type of voice recording on your phone is a possibility as an alternate. I think it can be also very helpful to have family or friend member accompany you to the visits, or even just phone in during the visit if possible. Sometimes just an extra pair of ears is very helpful to keep things organized. And then ask for print email resources if they are available. It is helpful to just have another resource in front of you. You don't have to keep it all in your head. And one of my patients recently said, it's okay to ask more than once. At first she said, oh, I felt bad. I felt like I had to ask a few times, 2 or 3 times, just because I couldn't remember. But then really it is okay to ask more than once. And you will continue to learn as you go. Another issue that can come up and is quite common is just intimacy. As patients go through treatments, there's just so much to deal with. And when it comes to intimacy, it really is not just physical, it is very largely an emotional component as well. For some patients, it's almost a measure of what was normal, when they were normal. And that can be something that, has to be reset. What was normal before is a different new normal now. And that goes with dealing with treatments, that deals with their daily life, their work. And that also is potentially intimacy as well. There are going to be physical changes. With surgery, there could be discomfort in areas where there weren't before. Scars could be uncomfortable. I think this is something that would need to be addressed and can be addressed as you share with your partner or family. There can be concerns about negative self-perception. There is change. There is something new and different. But I think that these can all be dealt with. There can be decreased libido. There can be lack of subjective pleasure. All these concerns are real. And I think there are places to turn. For example, your provider may be able to refer you to a physical therapist that could be very helpful and allow you to not be so nervous per se about areas that are uncomfortable. And this might be a pelvic floor physical therapist, for example. And there are other resources as well, such as sex therapy. Again, this is all important to think about and address. So in summary, ovarian cancer diagnosis, is a journey, comes with a journey. And as a patient, you are a participant, but you are also the leader of this journey. I think it's really important to keep in mind that you don't need to navigate it alone. There will be good days and bad days. And as you try different strategies, you want to keep those that work. And if there are some that don't work, then just, disregard those and look for a different strategy. And lastly, focus on you. I think that is critically important, is to just keep in mind what is really important to you. What are your priorities? What do you want to make sure that you're able to do or not do? And I think being centered will help you as you traverse this journey. So I just wanted to say thank you for the opportunity to share these thoughts with you. Thank you to the Ovarian Cancer Research Alliance for the opportunity to participate in this conference. Here is their website, of course. It is bountiful of resources for everyone, patients, caretakers, and health providers. Thank you.